Healthcare costs rank most burdensome among common living expenses for seniors. Yet, seniors are more likely to comparison shop for groceries, gas, or travel deals than they are to shop for a Medicare plan. What are the risks for not taking the time to review your Medicare plans? I'm joined by Bart Astor this morning with what to look for. Good morning, Bart.
Nice to be here. Thanks a lot, Kelly.
So there was a new survey that came out. It's called The Cost of Complacency, and it revealed the behaviors with seniors in health care. Can you share the findings of that survey for us?
Sure, absolutely. As you pointed out, despite it being the #1 most burdensome cost of living expenses that seniors feel about, they don't comparison shop for that as much as some of the other things like internet services or gas or travel expenses. And of course that leads to concerns that maybe they're not getting the right coverage or they're leaving money on the table. And I thought it was important that it turns out that over 60% of the seniors polled, that is over 1,000 seniors polled, they don't review their Medicare coverage on an annual basis.
Wow, that's quite a bit, over half. For that amount, that 60%, is it too late for them to review their Medicare options for 2018?
No, in fact, it's perfect timing. They have until December 7th to lock in their coverage for the year, which means you still have a couple of weeks to really look at it and carefully review what's important to you when you're looking at your coverage for, again, next year, not where you were in the past, but what's important to you in the future. And so there are things that you need to look at to make sure you are choosing the right plan. And I do understand that it's complicated and it's confusing and it's scary. And in fact, most seniors surveyed believe that it's very unpleasant. In fact, they report that it's more unpleasant than getting your driver's license renewed at the DMV or even doing their taxes. But it's so important. You can see how important it would be to make sure that you're covered and that you're not leaving money on the table.
Absolutely, but with those options of selection, is a low premium always the best option for seniors?
No, as I'm glad you brought that up. You know, premium is certainly one of the costs that you'll face. But in addition to the premium, you also have to know what your deductibles are and whether there are co-pays to seeing medical personnel. And you have to worry about whether there are limits on some of the coverage. For example, you may have a lifetime limit on diagnostic tests like PET scans and MRIs. That will add to your costs, so unless you're covered for that, you can't just look at the premium itself.
And Bart, before we go today, what additional tips and advice do you have for seniors when choosing a Medicare plan?
Thank you for asking that. I think it's really important, as I said, to look at the kinds of coverage and for the future. So for example, if you need vision care, or you'll need dental care or hearing exams, that may not be covered with your current plan, but you may be able to avail yourself of that in a different plan. So if you look at that and look at the whole picture, not just the cost, you might see that, oh yes, well, I'm going to need vision care for next year or in the future. And let's face it, as seniors, our health needs change every year. So it's, again, pay attention to what's ahead in the future and not just the rearview mirror.
Absolutely. Well, speaking of rearview mirror, we see that website behind you. For more information, our viewers can go to costofcomplacency.com.
That is one source. Absolutely, you'll get some great information there. Also, go to Medicare.gov, where you'll also get the great information and be able to search for the kinds of things that are important to you. I also want to encourage people to go to their local senior centers where they'll not only get information, but actually get to talk with experts to help guide them towards what's most important for them and not just get more information.
Awesome. Great information. Thanks so much, Bart.
My pleasure. Thanks, Kelly.
Mike, over to you.